guys, but, well, 3 old white guys in Union George Clooney, as we thought. All right. Ryan, tell us a little bit about what CARIN is doing.
So the CARIN Alliance is a group of multi-sector stakeholders in healthcare that are looking to advance consumer-directed exchange. As you heard yesterday, Dr. Brailer and Nish Chopra was some of our founding leadership, and under the direction as well as former Secretary Mike Leavitt, when he left public office, he really wanted to solve difficult problems. And so when he was in public office, he would bring together multi-sector stakeholders to try to do that. We're echoing that same tradition within Leavitt Partners. We run about 30 of these alliances a year to solve really difficult issues within healthcare and certainly consumer access to data qualified. And so we are looking at problems that are specifically aligned with the ability to move slides. There we go. We are specifically focusing on the use case of 2 use cases. One is how an individual invokes their individual right of access under HIPAA to electronically access their medical information. Show of hands, how many of you have actually filled out a HIPAA authorization form recently at your doctor of choice or hospital of choice? Okay. How many of you have filled out an individual right of access request about where to send your health information? Amazing. There's 3 of you. I'd like to talk to you afterwards, actually, about which providers you've done.
You've got an odd group here.
So that is true. That's very true. So we are working with AHIMA and other organizations for their 100,000 members to develop, at least initially, and I know this causes this room to start to freak out, a paper-based version of the individual right of access that allows for individuals to say, I just want my information. That was released by AHIMA last summer, and they've had something like 40,000 downloads of that paper application. At a minimum, what that does is when you go into a doctor's or hospital now, at least you'll be able to say, I want my records to be able to share to different entities, and then I want my information also to be shared with me. We're looking at trying to find a way to electronically do that. Second use case is around the actual, as Dr. Rucker says, the ability for that EHR to actually send the information outside the system. And there are some, as Ariane mentioned, there's still some technical hurdles, but they're mainly policy and business hurdles that we need to overcome. The key thing here is that, as we've mentioned before, a person who's invoking the individual right of access to HIPAA, the policy is already there in order to make this work. And so from a policy and a regulatory perspective under HITECH and HIPAA, as well as MIPS, every provider and every hospital in the country participating in the MIPS program will need to have these APIs installed by January 1st of 2019 based on the proposed rule that was out there. Every single one, if it doesn't get delayed. But right now, that's why we believe there is a significant opportunity to gain electronic access to that information in meaningful ways. What are we doing in the CARIN Alliance to help advance that? Again, we're a multi-sector group of stakeholders. We're trying to advance the industry. So we're creating a trust framework that allows for the exchange of data outside of HIPAA. Keep in mind, we've been talking for 20 years about data exchange within HIPAA between different covered entities, which has the policy and privacy and security rules associated with that. But data exchange between a covered entity and a non-covered entity falls outside of HIPAA. It actually falls within the Federal Trade Commission in Section 5. That's who governs that type of data exchange. Well, what's interesting is we have never before really tackled the electronic data exchange outside of HIPAA in a real meaningful and holistic way within healthcare. We're trying to set up a trust framework for how to do that and ensure that the industry is agreeing to that approach. We have a number of participating organizations. We have every EHR vendor in the country represented either through their association or directly. The folks on this stage, Allscripts and Cerner, have been tremendous partners for us in making that happen. We have a number of government entities, the VA, CMS, and others. Dr. Rucker and the ONC have been tremendous supporters of this all the way back to Karen DeSalvo and Vindel Washington. We need to make this work as an industry because all of you out there are struggling to try to gain access to the information. Ideally, what we would have is we would have a situation where any consumer can start in any app of their choice and download remotely their electronic health information from any provider or hospital in the country. When we've done that, we we can definitely declare success. And as Dr. Rucker said, there's potentially other things associated with that longer term. So we're an action-oriented coalition. Back in February at HIMSS, we had an opportunity to demonstrate when there was only 5 implementations live of the FHIR APIs to demonstrate the ability for a consumer to access their electronic health information. 2 of the 5 companies that had FHIR-based APIs in production were on stage with us at HIMSS. We did this again at Datapalooza, where we pulled it from multiple organizations, and I think the key thing here is this is FHIR production-ready APIs with these FHIR servers associated with that. And now, obviously, there's more, as was mentioned up here, more providers that are doing that. And today, what we're going to be able to show is a consumer starting in an app, 2 different apps actually, pulling information from 2 different organizations, New York Presbyterian and Cedars-Sinai, with 2 different EHRs, Allscripts and Epic, again, into 2 different patient applications, increasing the complexity. And we're going to do that through the power of authenticating through social media, and we'll talk about that shortly.
That's great.